I'm often asked about sleep training a child. Let me first address a few things. Consider this a disclaimer, but number one, every child and every parent are different. They have different needs, and it is best to individualize the support that you need for your child's sleep issues. I can only give you general ideas and concepts. Number two, if you have a specific concern about a physical problem that your child may have, the best resource is your pediatrician, your medical provider, or your pediatric sleep doctor. So, when we talk about kids, there are a number of age ranges that we are looking at. A newborn to a 3-month-old child will sleep on their own schedule. They may be sleeping most of the day, they may be sleeping most of the night, or they may be awake for long periods of time or short periods of time. There is no specific training that needs to be performed at that very young age. Most infants will start sleeping through most of the night around 3 months of age, and certainly by 6 months of age. Those who are not sleeping through the night at 6 months of age need some modifying of their schedule. So parents who are having difficulty with their 6-month or older infant, they can get some help in getting the child to sleep through the night. In the first year of life, it's important for the parents to understand that you're not going to spoil your child or damage them both ways by hugging them, holding them, gently rocking them, or giving them comfort when they need it. So then again, the issue is it depends on the child and the parent. Then there are older children over a year of age, between a year and 3 or 4 years, and then older than 4 years to, let's say, 10 or 12, and then adolescence. So each category has its own common difficulties with sleep. So then again, this format is not appropriate for me to address each one of them. A lot of questions are asked about the younger children and infants, so I will address that today. Number one, if your infant between 6 months and 12 months of age is not yet sleeping through the night, the question to ask obviously is, why might that be? A common answer is that the infant has not yet been weaned off of the habit of being fed during the night. If that is the case, then you have to gradually wean off the nighttime feedings, because physiologically, an infant over 6 months of age does not need to be fed during the night. Their body is perfectly capable of maintaining blood sugar levels through the night. How do you wean them off the feedings? If this is a breastfed, nursed infant, then you're not going to, because there's a lot of difference between breast milk and formula. So infants who are formula fed tend to stay asleep for longer periods of time. Their routines are different. Infants who are breastfed, they need feedings more often, and they will continue to wake up during the night. Those who are being given formula during the day, I would clarify, because there have been questions, their formula should not be diluted during the day. Most of them do not need to be given water during the day. They're fine just with the formula. But during the night, if they receive 1 or 2 feedings of the formula that you're trying to wean them off, you need to gradually either decrease the amount of formula you put in the bottle for the baby to take during the night, or dilute it with a small amount of water so there is less nutrition that the body is dependent on only during the night. Another question asked is, should I let my child cry? And is letting the child cry for a long period of time, is there something terribly wrong with it? Is it hard to do? Is it not hard to do? Is it a good method of helping a child learn to sleep through the night? Then again, there are differences. In some cultures, children will sleep in the same bed with their parents for a long period of time. In other cultures, they sleep separately in a crib in the same room, sometimes because of a lack of space that the family has, or in other situations, children have a separate room to sleep in, and they sleep in a crib completely separate from their parents' bedroom. So then again, it depends on the situation, the parent and the child, and what you're trying to achieve. The main concept to understand is that young, normal children, healthy children, will change their habit. They will adapt to a new habit very quickly. It is the parents who feel that this is something hard to do sometimes, or they feel that this is emotionally too hard on them or their child, and they feel nervous about this. So if you decided that your child is not sleeping through the night and you're going to let your child cry out for a night, 2 nights, or 3 nights until he or she is able to learn to soothe themselves and sleep through the night, and you're comfortable with that idea, there is nothing wrong with that. For other people, it seems too extreme, and in that case, there are modifications of this same routine. Some parents will check on the baby multiple times, walk in the room, walk out of the room, give the baby some water to drink or not, or give them a pacifier or not. Then again, it's a matter of what you are comfortable with and how your child is responding to it. The bottom line remains that given the right circumstances, given that your child is otherwise normal, and given that you're not going to any extreme, your child is going to learn and adapt to whatever you're trying to teach them very quickly within a few days. So if you're willing to sweat it out and you think this is not particularly dangerous for your child, you could let them cry for an hour, hour and a half, 2 hours for the first, second, or third night. They're going to very quickly learn to sleep through the night. If you can't really take it, or if you think this is too traumatic for your child, and the real test of that trauma is how you feel and how you see your child react to the situation. That is why I say to claim that there is a certain specific rule that applies to all children is wrong. You have to be conscious of your own feelings about the situation and your child's feelings about the situation. You as a parent are more reliable for me than anybody else. Your feeling is more important. At the same time, I, as a physician, want you to be confident in you being a parent. You are the one who's going to control the situation, not the infant's personality, because this tends to be something that happens almost between every child and every parent, that there is a power struggle that starts at 3 or 4 months of age, and it's never ending. So What is the bottom line? The bottom line is be aware of your own comfort zone and how your infant or child is reacting to the situation. Number two, if in doubt, talk to your medical provider. And number three, be consistent. Lack of consistency on the part of the parents is a major contributor to children having sleep problems. If you really need specific help, we're here for you. Feel free to reach out, talk to us, email us, text us. We're here to help.